Welcome to the Garfunkel Wild podcast. My name is Philip Hammerberg, and I'm here with David Trasky. We're both partners with Garfunkel Wild. David is the co-head of the firm's DC office. Before joining GW, David came from working at HHS's Office of Inspector General. Today, we're going to be discussing the features that make up effective compliance programs. OIG has identified 7 elements of an effective compliance program. We're going to be discussing the first element, policies and procedures. First, David, what types of entities or providers need a compliance program?
Hey Phil, thanks for having me today. I really appreciate it. I guess the answer to the question would be anyone who is participating in the healthcare industry, right? From the smallest providers to the largest providers. Um, Gone are the days where compliance programs were optional. Um, Participation in the healthcare space nowadays, in particular, if um, providers are participating in Medicare and Medicaid, compliance programs are a requirement.
It's good to know. And circling back to the elements of a compliance program, what can you tell us about the element policies and procedures?
Yeah, so that's the first element that OIG has focused on, with the understanding that um, an employee code of conduct and written compliance policies and procedures are sort of the foundational or critical elements of any effective compliance program. And so that's typically where the starting point is. Um, the compliance program itself um, really endeavors to sort of set the tone at the top, where everyone in the organization, regardless of title or status or seniority, is responsible for promoting and incorporating a culture of compliance in its day-to-day operations. Um, Typically, codes of conduct and compliance policies and procedures are developed with assistance or direction from outside counsel, from compliance officers, and the compliance committee within an entity or an organization.
What do these policies and procedures typically address?
Well, they really kind of focus on two main areas. The first is the implementation and operation of the entity's compliance program itself, which includes the 7 elements that you mentioned earlier. And also, the second part of it is um, that the policies and procedures have processes by which an entity or an organization can reduce their risks of that might be caused by any non-compliance with federal or state laws, rules, and regulations.
Okay. After these policies and procedures are drafted, do they ever need to be updated?
They do. I mean, typically what we would recommend and what OIG recommends is that the policies should first of all be accessible to all of the folks within your organization. They should be written in an understandable way, and they should be reviewed at least annually and updated as necessary. Um, and I think the other important thing to sort of take away from this is that the policies and procedures are not a one size fits all, right? So the policies and procedures or the employee code of conduct for a hospital is going to look different than, say, for instance, a small medical group practice, right? And so while there are certainly foundational uh, areas that are included in every compliance program, it's important to note that the compliance program should be fine-tuned or take into account those types of risk areas that are specific to the individual, the entity, the practice, kind of based on their organizational experience.
Thank you. At this point, I don't think I have any additional questions. Um, unless there's anything you'd like to add.
Yeah, I think just one other thing, or perhaps two other things. One is that um, generally speaking, these compliance policies and procedures, they apply to everyone within the organization, right? Whether you're a physician, an employee, a contractor, um, they apply to everyone because, in a sense, compliance is sort of a team sport. We want everybody, promoting and paying attention to compliance. And oftentimes that means that these various policies and procedures and compliance matters become part of a performance evaluation for employees and contractors. And then I would say, in addition, that there are some areas that are definitely important to hit on when you're thinking about policies and procedures. So some common compliance risk areas might be, for example, billing and coding, documentation. It could be about compliance monitoring and training. Another one might be making sure that you have a process in place for screening so that you don't hire excluded or ineligible individuals. And also then there's going to be policies and procedures related to relevant state and federal laws, for example, the anti-kickback statute or the Stark Law maybe. And also it's important that folks understand that they won't be penalized or retaliated against for good faith participation in the compliance program. Ultimately, at the end of the day, what we're looking for is for the compliance team to be viewed as an ally rather than an adversary. And if we're all sort of working towards the same compliance goal, then that's obviously benefits the entity or the organization, as well as the individuals who make up those entities or organizations in the long run.
Excellent. Well, thank you. And thank you for participating in this first episode of our compliance series. If you're listening, please like and subscribe, and have a great day.
Thanks, Phil.